Um, my name is Linnea. I am the Adult Services Librarian here, and I have a few announcements. We are actually recording this program so that those who couldn't be here today or feared the wrath of a Minnesota storm decided they wanted to watch it later. Hi, Sin. So we are recording this so that we can share it at the CHANorg website. It's COB for Communities of Belonging, CHAN.org. So people to watch at their convenience. So I have some announcements before we begin. Anytime I have an audience, I like to share information because I'm a librarian. This program was made possible by the Chanhassen Communities of Belonging. It's a group of local volunteers which hosts multiple programs every month, and you are all welcome. Brochures that include all of our spring programs are available for you to pick up on the back table, as well as a flyer listing specific programs just for Communities of Belonging. All library programs are free and open to the public. And you will also find information on a pillar next to the information desk in the library, where we feature information on Communities of Belonging. You can find information on the library's website, and as I mentioned, the COBCHAN.org. So I wanted to tell you about a couple of more than a couple of upcoming programs to get people planning and putting them on their calendars. Next month, we always have a second Saturday of the month. We have program featured speakers or a topic, something to bring us together as a community. And so that's why we're here today. April is National Poetry Month, and so we're going to have our 5th open mic, and they've been a wonderful experience. One of my favorite things to do. It's an opportunity to share something you've written yourself, or a favorite poem, or a short prose piece, with a warm and very supportive audience, and there's no experience required. And we also welcome additional audience members who just want to listen and not planning to read aloud. Then, Saturday, May 9th, another very important community topic is about housing. And so we have Hope for Housing. You can learn about the mission, impact, and vision of the Carver County Community Development Agency, from affordable housing and senior living to small business support and community land trust. The presentation will highlight the Community Development Agency's commitment to creating vibrant and inclusive communities for residents of all ages. And a sneak peek for summer coming up, June 13th, we will have a presentation of the Senior Fraud Prevention Toolkit by the Minnesota Department of Commerce. And we've had the speaker, Boima Freeman, has been here a couple of times. Really wonderful information about scams and fraud, and especially now with AI, so many slick ways that they have for especially taking benefits that we've all earned, whether veterans or through retirement programs that they target people over 55 in particular. Then in July, we'll have a presentation on the Carver County Family Resource Center in Chaska. It's a one-stop location for providing resources to families and individuals, no matter what their need, and connecting them to all the resources to help them for living. And in August, we are going to have something just for fun. It's a game day for adults, including backgammon, chess, and cribbage. And if there are enough people that show up, we'll have some tournaments. So we will encourage people to join us in August. Every Saturday morning that we're not doing a program in here, there is a Communities Belonging coffee gathering in the lobby of the library. And we have a nice regular group that meets, but there's always room for more. And it's just a chance to get to know your neighbors and chat. So we hope you'll drop in. The second Monday evening of the month, for March was last Monday, you're welcome to come paint mandala designs on stones that our group uses to build community and community awareness of our growing initiative. And right now in our lobby, we have a display of a bunch of the stones until we get them outside again when the weather stops snowing, and we can leave them along garden paths, and people can find them in the community. What is this? I want to know more. That one does require registration because we have limited supplies. So we hope you all join us. The next one is April 13th, Monday, my mother's birthday. Right, you can sign up on the library's event calendar, but most of our programs, we welcome you to drop in. We ask for sign up just so we can plan for how many seats to have. So after today's program, our speaker has said he will stay and answer any questions for as long as it takes. We do ask you to take a moment to fill out a very brief survey on the back table to let us know what other programs you'd like to see and give us feedback. And then you can just leave it anonymously in the back table. And there's also a place to sign up if you're not already signed up for Communities of Belonging to get newsletters about upcoming programs. All the things I just said would come directly to your inbox. Finally, I am pleased to turn things over for today's forum topic to one of our leadership team from Communities of Belonging. Jerry Sercha is here to welcome our special guest.
Thank you, Andy.
Thank you.
Good morning. Thank you all for coming this morning. I'd like to, our special guest today, speaker, is retired Navy Master Chief Brett Lyon. Brett is on the Carver County VSO team and is responsible, along with several other people, for working hard to make sure that vets get the benefits that they deserve. Master Chief in the Navy is the top enlisted rank. For those of you who have been in the service, it's an E9, the rating from E1, enlisted 1 to enlisted 9. And you don't get to that level unless you're the best at what you do. And I can actually remember when I was in the Army, butter bar lieutenants hitting a brace and saluting sergeant majors. That's how powerful those folks were. They also know where all the skeletons are buried. But I'm probably a great poster child for you don't know what you don't know. Because in 2007, I was told I had prostate cancer. Now, I didn't know anything about VA at that point. Didn't know anything about Agent Orange. But a friend of ours, whose husband was a Marine officer, fought in the first Gulf War, had died of cancer from Agent Orange. Yeah, they were still using it in the first Gulf War. And she said, Jerry, weren't you in Vietnam? I said, yeah. He said, you need to go to the VA. You're going to get a benefit, a disability benefit. I said, really? And she told me what to do, and I did. And at the time, the Carver County VSO office was out in Waconia, in that building behind the old Sherman tank they had, in front of the building. And I'll never forget Sergeant Major Dave Prem, retired now, walked through the whole process with me, got me lined up an appointment for the VA, went through the process, and sure enough, I got a benefit, which I get to this day, which is tax-free. So if you don't know, you got to hook up with the VSO office. These folks will walk you through a process that will get you benefits that you had no idea that you were eligible for. They do a great job. They work very, very hard at it. And so at this time, I'm going to turn the meeting over to Master Chief. I still call him Master Chief because when I was running retail stores for big companies like Best Buy and Circuit City, I made sure that the salespeople, especially when I was running stores in the Norfolk, Virginia Beach area many years ago, I made sure every salesperson could identify the rank of every service in that area. Norfolk, Virginia has 25% of the country's U.S. Navy stationed there. I wanted to know the enlisted, the officer rank, Army, Air Force, I don't care. Because when I came in a uniform, that salesperson better address that military person by their rank. And they did. And I made sure that they did. So at this point, I'm going to turn it over to Master Chief Brett Lyons.
Thank you so much. Hello, everybody. My name is Brett, and I'm from the Carver County Veterans Service Office. As you said, we moved from Waconia to Chaska, and we're available every day of the week for all kinds of different stuff. So why am I out here? Basically, I'm out here to make sure everybody knows that there are additional benefits available if you served in the military. Doesn't matter what branch, doesn't matter what type, everything has a way, but everything is individual. So someone who served right next to you may not get the same benefits you get. just because of their circumstance. But that's what our job is to look through records. If you can't find those records, I'll help you find those. If you don't know where to begin, that's my job. Basically, we're there to do everything a veteran would need to get any type of benefit available. So it's a lot of them, so I have a list. So service connection, that is basically where the VA pays you money for having been injured in service. That would, my most common is tinnitus and bilateral hearing loss, just because of the weaponry and the equipment that wasn't provided. Once we get a service connection, then we can get you into VA healthcare, which is a whole nother thing. That's free hearing aids, free eyeglasses, that's care for any of your medical stuff, that's temporary pay while you can't work, all kinds of stuff. Off of that, we also go to the state, there's benefits, and we do the federal benefits with the VA. We have survivor's pension. That's for spouses of those who were married, spouses of veterans who have passed. There's benefits for them, but if you don't come to our office, we can't get them for you. We don't know. We don't pay attention to everything around like the news to know who has passed and when. Our primary point of contact is when a veteran or a surviving spouse comes to our office because they have a bill they can't pay, or they have something they need to do that they are unable to. Unfortunately, everybody passes, so then we deal with veterans' burial benefits. But if you never come to see us in our office, there probably won't be any burial benefits. The VA figures if you come and you ask us for issues like you have bilateral hearing loss and you need hearing aids, that's showing a need. So therefore, when you pass, the VA will come to your assistance. If they don't know about you, they don't help. So I have a lot of surviving spouses calling of veterans from even Vietnam who are looking for benefits and there aren't any because the veteran never came to see us to get anything little as hearing aids, care for cancers, in-home health care. There's a lot of stuff that we do. Yes, sir.
I forgot to mention, when I,
Hold on.
2007, in 2007, there were only 11 what they call presumptive diseases caused by 2007. Today, there are over 50 diseases that are caused by Agent Orange. So don't use presumptive. You're not affected. Sure.
In addition to that 50 presumptive conditions, what he just mentioned are conditions that the VA accepts were caused by your service because you were exposed to Agent Orange, asbestos, toxic chemicals. There's a list that if you have one of those conditions and you're there, it's an automatic service connection and we work with that. We get you benefits that are on an ongoing basis until it's either cured or you pass. And then if a veteran dies of something that they're service connected for, like suppose you have cancer and you pass, on your death certificate, if they mention that prostate cancer was the primary cause, an underlying cause, or a contributing factor, that guarantees your spouse for benefits for the rest of their lives. And we do all the paperwork. I guess the most important thing is like Jerry said, don't make an assumption that you do or don't qualify. Let us talk to you about that because we usually find that 90% of our veterans have qualified for something. Even if it's small, it's still an additional help. Yes. The two currently, the biggest presumptives are for Vietnam veterans, exposure to Agent Orange, and Gulf War veterans, exposure to burn pits. And there's a lot of conditions that we might take for granted that's caused by the burn pits. Give an example. If you always have a cold and you always seem to have a stuffed up nose, there's a condition that slightly resembles that. So we would send you over to medical to get a certain diagnosis. Or if you had something that you couldn't figure out, like an undiagnosed illness, we know a little bit about that too. And a lot of the veterans in our office have been in those areas, combat areas. I did 15 deployments. There's others in my office that have done just as many or close to as many. So suppose you get to our office, we get you your benefit, all is good. It's still not over, because if there comes a time when you need special benefit, middle of the winter, your heater breaks. Well, we wouldn't expect you to figure it out if you didn't have the means. So you come to our office, there's grants from the state and local that help pay for that kind of stuff. We do the screening, we do the paperwork, and we do the submission. So basically, if there's a veteran that you know, please send them to our office. If they say they haven't been to our office, they should at least call us just to inquire. A lot of my veterans served during non-wartime service, 82 to 87 or to 90. They still have benefits. Just because they didn't go to the Gulf or just because they didn't go to Vietnam doesn't mean that they don't have any benefits. They still had to fire weapons. They still had to march. They still had to go in formation. They still had to practice. But basically what I'm saying is, I want everybody to understand that there is a place you can go if you are a veteran to inquire. We service anybody who walks through the door. Even if you're not from our county, we'll still figure out what the problem is and then tell you who to go speak with. And that's our mission, basically, is to make sure that everybody knows that anyone who's a veteran can come to our office for assistance. Questions, documents, like I have a list of stuff. There's so many different items, it's hard to kind of record retrieval, veterans treatment court, which is another benefit of being a veteran, transportation to VA appointments. Suppose you're unable to emulate to your appointment. That's what we do. We have a whole list and rules, and it's all you do is call our office, get enrolled. I mentioned it from the state earlier. It's called Special Needs Grant. That would be the grant that a veteran has once in a life. Every veteran has a once in a lifetime grant. If they have an emergency, they can come to our office to get an application for. Again, we complete all of the applications and we submit it for you. So we tell you what to gather, we do all the paperwork, and then we submit it, and then we wait on the answer and walk you through that. Point of interest is most of our veterans needs grants are not paid to the veteran, they're paid to the entity. So if you needed your car repaired, you would bring me 2 estimates from a repair. We would submit that, and then the VA would pay that entity, not the veteran. I think that's all that I had initially, but there are 5 members to the team. Stephen Walker, who's our lead CVSO. There's Chuck Maxfield, who's our other assistant CVSO. Myself. We have a professional driver that drives our veterans every day. His name's Doug Crone. He's very well liked. He's liked more than we are. And then we also have Dean at our front desk. So Dean is a master of different things. If we need to find a document and I can't find it, and I've looked on my normal places, Dean finds it for me. If I need something deep researched, like something that connects to something else, Dean does that. So we have a really good team, and there's nothing that we can't figure out if given enough time and an opportunity. But we just want to make sure that everybody knows you're welcome to come to our office. You're welcome to ask questions in our office. We'll help you whether you're from our county or not. It's more important that you get the benefit. Yes. No, that's good. That's what we want.
Stay with you. He will follow through. He will give you numbers of phone calls so you don't end up on the answering machine. A few other key things that I think are very important. I apologize. I'm sitting over this revitalizing veterans dreams. I have a tendency of accidentally doing this.
This is great. The camera catches you. No, the other way. The camera catches you from about right here to that tape. There you go. Yes.
we receive to veterans. So we follow the complete career of the person of military career. If you have ever gone to your VSO, statistics, what is the mental health state of a veteran? How are we getting them healthy? Is what we're doing working? The staff's going in the right direction. We combating veteran suicide. I'm making an impact. If you serve as a veteran service officer, you get in trouble, you get in over your head, your number's not coming. I can't get your data number to prove what we're doing is working if you have never seen the VSO. So then we have a couple businesses that have fine, I need help. I need to go to the VSO. When I say these veterans are going to read it, what do they do to be healthy? This information isn't recorded, so I don't know what they do to be healthy. So go see this man, get your information to him, and then you never see him again. But I'm telling you, this is something that happened that brought to our attention. We had a veteran who was homeless. He had never seen the VSO. He went to the VSO and I'm in trouble. You know how long it takes to get your records filed? You know how long it takes to get the process going? How long it takes to get the application through? We couldn't help him until all that stuff was through.
Yes, we are.
If you see this thing, so it's a little bit of a simpler fix. So you don't have to do your benefits, go see the VSO. You're afraid to go? I go for you. I think it's all moving. I call you, I give you your social, I give your birthday, I give your last name. We get you vetted, help being vetted.
Mhm.
There's me. If you go to my nation, I will help you find your.
Well, thank you. So let's go back to a veteran who's never seen me and they come to our office. What happens? First thing, we try and find out when and where you served. That way we know what type of specialized benefits you'd have. If you can't find them, we help you find them by doing an intent to file. That lets the VA know that in time, you might be submitting a claim for benefits. Next thing we do is we would apply for specific benefits that apply to you, which is bilateral hearing loss, tinnitus, maybe a cancer, something presumptive, which is the VA has conceded that was caused by service, or something that's direct. Bilateral hearing loss was caused because you had to fire weapons, they didn't give you adequate hearing protection, and now you can't hear your grandkids, or you can't hear your spouse. That's what I do. Then after that, you get a benefit. Well, your benefit might entail you to have VA health care, property taxes, establish your banking with the VA. We do the spouses, the additional dependency, because they pay you extra if you have kids. We do all that paperwork in our office, and we know by what we see. So every veteran's different. Some of our veterans are in an apartment. They don't care about the property tax, so we don't mention it to them. But they are interested in healthcare, so we get that for them. We do whatever we can for whomever comes to see us. But it's a holistic. We got that from our previous VSO, who was Dan Tengwall. He said we should help them with everything from head to toe, not just what a veteran comes in and says, because like what Jerry says, you don't know what you don't know. We know a little bit more, just a little bit. But we're always available to help. And I hope that you understand that there's nothing we can't find if we at least try. I think we have one more.
Before COVID, we had a show on a lot of Carver County seniors looking to spread the word. And one of the things we heard almost every day, we had a threat, leave that care to people who really need it. Remember that?
Yes, I do.
Well, you don't need that, don't assume that the good stuff is being saved for somebody else. You may find yourself with benefits you never knew you had to serve.
But I will also be available after this for questions, concerns, issues, no matter what. I'll stand by and listen. But yes, ma'am. The question was for business cards, and I do have some. I will pass those out. Yes.
Does your office assist individuals with finding jobs?
Thank you for that question. We actually, our office doesn't, but right down the hall, there's a group called Career Force, and they are amazing. So we work with all of our county counterparts. Anybody who, from HHS to anybody who in the county can give you benefits, they are more than encouraged to call us as soon as they find out the client's a veteran. Then we work with them. But yes, there is a place for Career Force. They will help you with your resume. They will help you with job applications. They will even put you on the right spot. Like, hey, this company's hiring, because they meet with companies. So they can say, this company's hiring and looking for this type of person, which fits your profile. So you should go talk to them. Or they'll help you get training to attain the job that you're looking for. But that's a very good question. And we do that as well. We do almost everything from thank you for serving when you first get out to, and this veteran served honorably but died this way. We do everything in between. And if we don't know, we probably have a connection with someone who does the service you're looking for. So never assume that we can't answer. We get crazy questions, like the craziest of questions. And it's almost humor because we're like, why would they even think to call us? But then we think, well, we need them to keep calling us so that we can make sure everybody gets the benefits they've earned. Because these aren't us begging for benefits. These are benefits that our veterans have earned.
And it's not your He knows we have a connection with General Mills Plan. We give people, they know what Jerry does at his facility. So if you call him looking for a specific dialed-in thing, Stephen knows what all these nonprofits do. He knows the last 3 veterans have been sent to us. So he's going to go to the next nonprofit to give us a little bit of a retrieval. So we're not getting hit with everything. But with Flags and Honor gets hit with everything, then they turn around and come back to me. Or he'll send somebody to Flags and Honor because they write the checks. That same person will come to me because we do the one-on-one work. So he knows what all of our individual skill sets are. That's not up to you to know what all of us nonprofits do. So call him first because he's the middleman.
Yes, and we can holistically help you. So not only can we send you to an individual entity, but we can also do other things in the background, like we can file for a claim while we're sending you to go talk to someone about a job while doing your VA healthcare. We can do a lot of things at one time. We're lucky like that. But there was one additional thing is our services are free. You don't have to pay anyone to do these. We do this because the county pays us, and we don't look for any additional compensation. Our compensation is helping the veterans that live in this county. And if you don't live in this county, we'll point you in the right direction if we don't help you. But I've helped people from other counties because it's just easier. I don't want to send you somewhere and get a phone number and have you be on someone's answering machine and then think that all of us are bad, because we're not all bad. There's some better than others, but we want to be the place where people can trust to call when they have a question. And I'll be standing by after this for any individual questions, because a lot of things you probably don't want to say in public. I understand that. Yes. The question was, do veterans find themselves more comfortable when they're in the office with us? And I would say absolutely, because we have the same issues as our clients that are coming in to visit. Like I did 15 deployments. I got mental health. I got physical disabilities now. Pretty much every time somebody comes in to file a claim, it's on something I've already filed a claim for, either with myself or with the client. So yes, I can kind of read between the lines. And I know what questions to ask a veteran that maybe a civilian won't. Because I can get you feeling comfortable. I've been almost everywhere. So we talk about where you were stationed, and we talk about some of the stuff that we know we all did. It's way more comfortable because you're like, oh, this person understands what why I feel the way I do. Mental health is a huge portion of my job that we can't just advertise because it doesn't really make sense to other people. But in our office, I have my methods to get anything that you need to be said out and make it work for you. Were there any other questions? All right, well, I'd like to turn it back over to Charmaine. Come on up.
So there are family services. Family includes children and spouse only?
So when we talk about dependents, we talk about spouse that you're married to. Sometimes your ex-spouse, because they still will have benefits if they were married to you long enough while in service, or if the veteran's no longer with us, that counts for biological children, adopted children. Every case is different, but if your parents, like a lot of things can be applicable depending on the certain situation, but it's very, very like individualized. That's why I wish everybody would just come see me. My doors are open. I have a lot of answers, and what I don't know the answers to, I have great people I work with. Like, they're amazing. I feel very comfortable saying that we can help anybody who walks through the door between one of us. There's one more question. Go ahead.
How busy are you?
We receive about 20 to 25 phone calls a day, and there are 2 people that usually take those calls. That would be me for the people with Social Security 00 through 50, and then Chuck Maxfield, who takes them from 50 to 99. Steve will step in if something calls that's crazy or that we don't understand. Steve will jump in. Typically, that's with homeless and because those take a lot of time, because you're deconstructing the person's problem that led them to be homeless in like a 2-minute period, and they always come on Friday afternoon. That's it. Or Monday holiday. That's just the way it works, and we've accepted that. But our office handles anything, but it's all individual. It's so important for me to state that just because your neighbor got the benefit, you may not, or just because they didn't get the benefit doesn't mean that you can't get it. And that goes for almost everything. Everything is very, very, very individualized. But we're open. And if someone calls me, we usually call back within 24 hours, and we can almost always get them scheduled in that week, no matter what. Like somehow, my schedule is Monday, Tuesday I work from home. Wednesday, Thursday, Friday I'm in the office. That's usually when I schedule my appointments. My counterparts work in the office other days. So there's always someone in the office and always someone there who can assist. Even if you belong to me, someone in the office can still help. That's a good question, though. But I'm wide open. If you call, we can get you in, I promise. Were there any other questions? Yes, sir. Which ID card were you referring? So the question was, how do we get to transportation for the ID card? And I guess I was going to ask, which ID card? Are we talking about the VA health ID card? Okay, so that's the card that if you were service connected through the VA, they give you an ID card, which is a federal ID, which means you can fly on it. Like it's pretty serious, and it shows your picture with VA healthcare enrollee and then a service connected. That service connected will allow you to ride Southwest Prime for free and access discounts at Home Depot and Lowe's. But now how to get it is you can call our office and give us a 24-hour notice, and we can provide transportation down to the VA and back to your home. Yes. It does. Oh, yeah. Yes. So basic, oh, I'm sorry. Yes, so to get an ID card, you would basically have a service connection. Once you have a service connection, you can just use your general driver's license at the VA Medical Center in the Flag Auditorium to get it. In order to get a ride down there for that, just call our office and speak to Dean. Dean schedules all transportation, and we can't do anything without letting Dean know because it's usually wrong if we do. That's what I've found. I usually make a lot of mistakes when I don't include Dean. But we give rides down and rides back, so it'd be very easy, and your spouse can ride along for these rides. Speaking of transportation, which is another big portion of what we do, we offer transportation to the VA Medical Center Monday through Thursday. First appointment beginning at 8, last appointment around 13:30 or 1:30 in the afternoon. On Wednesdays, we go to Shakopee, from your home to Shakopee and back to your home, but that's the only day we go to Shakopee. Fridays we're not available because usually that's the day we do maintenance and bingo runs and specialty transportations. But if you ever have any questions about transportation or anything office does, you can just call me. I'll leave my business cards. It's one number to get all the services. So even if you're looking for Chuck, you still call the 952-442-2323. If you're looking for me, guess what? It's still 952-442-2323. If you want to get a hold of Steve, you're still going to call the same number. So we're available. Please call us. Don't hesitate. Even if it's just to talk, we do that too. We have a couple of veterans who don't have anybody else, and they're very ornery, and they call once a week, and we talk to them. Seems to get through. But we're available for any questions. And we will also, like Jerry said, go out to assisted living, nursing homes, wherever somebody has a 3 people minimum, 2 people minimum, I don't care. We need to make sure everybody knows there hasn't been forgotten. Because there's nothing like sitting in one of those homes and not feeling anyone cares. I see another question. Hi.
Does your organization assist senior here to get into a senior care apartment? Not necessarily assisted living right now, but just into senior apartment.
I would say that you should call our office because we do have some new places that have opened up, and they reached out saying we want veterans living here, and they're not necessarily assisted living or nursing homes. So yes, please give us a call and we'll figure out how we can assist. But we do a little bit of everything because everybody has to live somewhere. Were there any other questions? Anything I forgot? We talked about Veterans Treatment Court, but we have another gentleman here who's an expert in that in case you have a question. We talked about transportation. We talked about service connection. We talked about pension. So I was discussing it earlier. So in order to get, at the end of time, medical assistance from the county, you know, like when a person runs out of their money, they're in a home and they need the county to pay, there's a little stipulation to that. If you are a veteran, you must have at least applied for your VA pension benefits. If you're not eligible, we can report that and say, help the heck, we can say this veteran is not eligible for VA benefits. They're receiving the maximum amount of benefits at this time, and the county will move on with the medical assistance. But that's one of the stipulations. You have to apply for your veterans benefits before the county benefits. We do that. We tell you everything to grab, and we do the submission electronically. So it's much easier than somebody trying to do it on their own. We have a dedicated upload system for submitting things for healthcare, for all the service organizations. So it's almost easier if you do it through us. And then we know what's been submitted. But you can always call us if you need transportation to anything, we'll figure it out. Pardon? Yes, Dean is the gentleman you are always going to want to talk to for transportation. He is a transportation guru. Yes, was there another question? Yes, we will. We prefer not to because that's in a different county, but the answer is yes. Because you might not even need anything huge. You might already have all the documents and all the information you need. You just need somebody to kind of submit it. I would feel horrible sending you somewhere else to submit the same documents that you're bringing to me. So yes, we will help. We find a way. There you go.
There's one other thing, gentlemen, was back on the shirt.
Yes.
I'm trying to get the serve for him. Bill is a medical coordinator for the First Judicial District Veterans Treatment Court. Veterans Treatment Court, if we justice involved veterans, this would be felony conviction, drug, alcohol, anger. There's a program. Complete success. Program usually takes at least a year to year and a half. If they successfully complete the program, all likelihood they can have those marked taken off.
And see from
They get to
that table. So if you say whatever he is, you build on it.
guys like Bill and I,
You're recording this.
what the court does is they pair and build up with a participant. We help that veteran walk through the program.
That's for the
Make
recording.
sure that they
That's for the room.
go with the George.
We've brought handouts for you. We expected you.
I know, I had 11 o'clock written down. Good morning. Jerry and I have worked with the Veteran Treatment Court for 8-9 years now.
Longer than that, I count well.
Seems like longer. No, it doesn't either. It's a great program. It was designed and is in all 50 states at this time. And every county in the state is required to, at some point, become involved in the Veterans Treatment Court. It was started in Carver County in 2014, and it's been a good way for veterans to get their lives together when they get themselves in trouble. And it's usually not the alcohol, the drugs, the things like that. They've got other underlying issues that need to be addressed, and that's what this court does. It gets them the treatment, it gets them the counseling, it gets them whatever they need. That court is staffed by a VA representative, an outreach representative. The veteran service officers are in court. Every asset that we've got in the state to help veterans is in these courts. And we always are looking for mentors, we work with the individuals one-on-one, and we're not there to counsel them. We're not there to tell them how to do things. We're there to get them to the people who can help them when they have questions that they don't want to talk to the court about, but they will talk to us. So it's a great program. If you've got time, we have court twice a month in Shakopee, and it's a great way to give back. And it's also a lot of fun to watch people get their lives turned around and see the changes that they make. So if you have any questions, we've got some handouts and things like that, and contact information if you want to think about that. We're always looking for, especially we're looking for women veterans. Right now, we've got one who handles all of the women that come in, and she's been a saint for us because she's been with us from the start, basically. But we always need more veteran mentors to help out, because we try to not double up. We try to not take all your time up either. So it's a great program for that. So that's what I know.
And again, that's one of the organizations that works through our office, so we can provide any kind of assistance to a veteran in need that comes asking. They say they got legal problems, we know who to call. They say they need housing, we know who to call. We have special programs on an emergency basis and some on a more long-term basis. So if on a Friday, my favorite day, a veteran comes in and says, I don't have anywhere to go, we have resources. Not the way you'd think, but we can get them in a hotel for the weekend or for the week while we figure out why they're there and why they have their family or why they're not working or what issue happened. That's what we do. So any problem, somebody has an answer, usually Steve. Stephen Walker's the person you call for the really hard problems. But I think that's it. Thank you.
Okay, just making sure we're recorded on both types. I want to thank you all, and we got a couple of bonus organizations in, which we really appreciate, because that's what makes a community, is all the groups working together and referring to each other and seeking support from each other and knowing that we're all caring about the greater good of our community around us. So I thank you again, and I would offer applause, but I'm worried I'm going to make more noise here. So if you would thank our speakers and our impromptu guests. Again, if we get our sound all good, we'll make sure to have this up on our website probably early next week. If there's anything, if you came in after it started and want to catch up on what we had. But the biggest thing is on the COBCHAN.org website, COBCHAN for Communities of Belonging Chanhassen.org, we will have information to refer to these offices and resources so that you can go there if you need more information. And again, we have coffee and treats. Please stay and chat and ask your questions. Yes?
Speaking of the coffee, just one more note. On Tuesdays, our CBSO, the main guy, Stephen Walker, has coffee with veterans. So even if you don't have a problem, and you just want to talk, you can still find a way into our office. Tuesdays, just for coffee. It'll work too.
I love a regular time to come. All right, thank you. Please stay and enjoy a treat and visit together. Have a great day.
We'll come out.